Morning, morning, morning. Good morning. Good morning to you.
I told you January, as you know, is Drug Awareness Month, and so often every January we connect with the National Council on Substance Abuse, not just to hear what they're up to, but to also reinforce the information to you about how we can all partner in managing abuse of substances. And I said it broadly as substances because there's so many different types of substances that people abuse. And so I'm happy to be joined this morning by the Deputy Manager of the National Council on Substance Abuse, Troy Wickham, and next to him is Nicolette Williams. She is from Verdon House. Good morning, both of you.
Good morning. Good
Thank
morning,
you.
Barbados.
Happy Drug Awareness Month, if you want to say that.
Thank you. I would echo your sentiments. Happy anniversary to the NCSA and happy Drug Awareness Month to Barbados.
What's the anniversary?
We'll be celebrating really 30 years. We have been in existence for 30 years.
Congratulations. You've grown up now.
Yeah, we're adults.
In this growing up, what have you learned about not just the awareness of drug abuse, but about yourselves as people?
We have learned over the years that basically we want to see persons accepting substance use and substance abuse as what we call a public health issue, not just a matter for the judiciary. It's important for Barbados to understand that substance abuse and substance use is a public health disease, is an addiction, is a sickness, and we must help each other, collaborate with each other to basically combat this issue.
And what are you seeing in terms of the ages of people who are now having this addiction?
Over the years, we have recognized that as we conduct our research, that persons as early as 7 admit to using some substance in their lifetime, at least once, or being exposed to substances. And one of the main places they are exposed to the substances are at the home, or from friends or from family members. And this has been concerning for us as we progress.
You know, when you call the number 7, it hit me at the heart, at the core, because these are our treasures, our little ones that we love dearly. But to hear that they're struggling in that sense with some level of addiction because they've been exposed to it, it makes you shudder because you question what's going on.
I wouldn't say that they're basically addicted, but I can say as, culturally, that when you're at home, your granny, your mother, your uncle, your brother, your sister, say, have a shot of rum, have a shot of brandy for the worms. And that, over time, can lead to problematic use as persons continue or have the appetite then for substances, especially alcohol.
And then they find themselves by you, Nicolette.
Yes, that is so true. They do, both men and women, yes. So we've realized as a residential and treatment facility, Verdon and Marina House, that when clients express further in their therapeutic journey, that they do start from ages under 10 years old, so yes.
So how do you begin, Nicolette, to unravel that addiction? Because it's something else happening in the mind that is leading to that. How do you begin to identify that so that that patient, to use that word, is able to accept and then change?
Well, we are a 12-step and mental health facility, so we do have recovering addicts who have long years of sobriety and clean time who work face-to-face with these clients. So we do follow a 12-step program where our first step is to admit that we are unmanageable and powerless to the drug. So that is the first step with continuous treatment work with the clients, that they eventually, and we hope, and we work with them day after day, for them to see that they were actually powerless to the drug, and it's to accept that. Once they do, without the denial and the guilt, and we go through all of that trauma, therapeutic interventions every single day, we do hope that there is hope at the end for them to accept that, yes, I am an addict. Yes.
And I'm glad you said every single day because
Yes.
it's a daily struggle.
Correct.
Some people forget to brush their teeth. Imagine if it's drugs, your addiction, it leads you to the point where you have to have it.
Yes.
And that's a challenge that we have sometimes because it leads to other types of behaviors, Troy, that in itself can damage not just the individual, but their loved ones.
Yes, the families. It's important that support is given to the families, especially the close families and the home of persons who are addicted to substances. Hence the reason for Drug Awareness Month and our theme. Our team is basically NCSA strengthening prevention. And they always say, like, the good old adage, prevention is better than cure.
Yeah, indeed it is. So what's your plan for prevention?
Basically to educate the public on the dangers, the harms associated with drug use. And we start with research. Our research is key to employing or adapting or implementing what we call evidence-based projects and programs. And we do this through collaborations and through mechanisms. And one of our major mechanisms that has been functioning for, I can say, just about consistently for over 13 years is the Barbados Drug Information Network, which includes agencies like the Substance Abuse Foundation, which we call agencies from the demand reduction side of things, and the supply control, which is mainly law enforcement, which give us a overall situation, overall picture of the drug situation in Barbados. And we actually disseminate this report yearly, and it will be disseminated January the 29th.
Okay, so it's targeted.
It's targeted. It's targeted.
You know, we oftentimes, when we as a society begin to discuss things, we often go to the one plaster that says, start in the schools. Is that an approach that you guys take as well?
Of course, we have programs in our primary schools, though that the research has shown that early intervention, especially early childhood intervention, can lead to what we call delaying the onset of drug use or preventing it totally. So they give persons the facts surrounding the harms associated, especially the young ones, the harms associated with drug use, what to look for, the dangers of using substances, which can lead to problematic use in their adulthood.
Nicolette, what do I look for? So that I don't miss the signs.
You see, I want to echo what Troy is saying, because we at Substance Abuse Foundation, we also have a program called Teen Intervene in our secondary school programs. And as they're in the primary schools, we don't want to forget the teenagers, you know, because they also continue what they didn't learn in primary or in their younger years, take it into the schools. And we know that these adolescents take on a different journey now, and they're very open and honest about where they're at. So Teen Intervene, we are in secondary schools across Barbados, and we actually echo what Troy and his team at NCSA does. But additionally, we add the psychoeducational aspect and the emotional and social learning aspect as well, because youngsters, children and teenagers, they learn differently. So we want to be able to not just add the academics and the educational aspect. We want to make them learn from a more nonverbal, creative intervention ways, because that's how they are interested in learning and knowing about the substances and knowing about saying no to when someone asks them, do you want something, and know what those signs what signs they need to look out for. So, yeah.
Psychosocial, you're playing with my mind.
Sorry about that.
No. I'm being serious, because it starts in here.
Yeah.
My
Exactly.
desire
Yeah.
starts here. How
Curiosity.
I think. There you go. And then you're talking about the other social interventions as well. So it's how we relate one with the other, but it triggers from my mind.
Yes.
And as I was listening to both, I kept thinking, this is indoctrination. This is indoctrination. Is that a fair comment?
Yes,
Yeah.
I can say that. Yes, it's important that persons involved in what we call the drug demand reduction field understand that it starts with a person's perception to harm to these substances. So if I see nothing wrong or with any substance that I don't think it can be dangerous to my health or to my family or to the community, then I may get curious.
Yes.
So then that will impact my attitude and my behaviors. And that's what we try to prevent from early childhood interventions. Basically introducing the perception of harm, try to let them know using drugs are dangerous. We also have a program at the NCSA, Drugs and Life Skills, in our secondary schools, where we expose person again to drug education. We try to use alternatives such as sports, such as drama, and such as songs as alternatives to drug use and to keep the youth engaged. As we know, as teenagers, you want to fit in.
I remember.
Yeah, we
yes.
always want to fit in. We always want to be with the cool crew.
Yes.
And if it's trending for
Yep.
say to be using any substance,
Yeah.
then we tend to lean to that. So it's important to give persons the facts as the NCSA.
I could well imagine the challenge you guys have in handling this, because the stigma.
Yes.
When we think of mental health, we know the stigma there.
Yeah.
But then when you think of drug dependency,
Yeah.
there's a stigma to that as well. So when you don't want to show up in an environment where everybody says,
Same.
oh, he's walking through that door, that means
Yes.
Exactly.
Yes. Yes.
For sure. For us at the NCSA, confidentiality is very, very important. As you said, there's a stigma surrounded with substance use, because as soon as a person, even in the workplace, no one wants to admit, well, look, I'm addicted. I have a problem with alcohol. I'm afraid of being obviously terminated from my job. And it's important for us to educate the public again about what we call recovery-friendly workplaces, which is all-encompassing, which include management, colleagues, treatment facilities, NCSA, to have a program in place in place for the staff to encourage them to be rehabilitated and to be reintegrated back in the workforce.
So there's a lot of ignorance still. This is a
Yes.
whole month. I mean, we're still in the 8th day of the month. There's a lot of activities that you guys are up to. Talk to me a little bit about how you're approaching this month and getting that sensitization on the road.
I can say Saturday the 11th, we'll be having a community drive-through in the northern districts, starting with St. Lucie. I see the minister was just here speaking to the gathering, and it's important for us to we'll be driving through St. Lucie with what we call a community drive-through, sharing important messages, making stops, engaging the community about the harms associated, drug prevention messages, how they can, the services the NCSA conduct, and we start there. Then we obviously start with God. We're having a church service. It starts at 8:30 at Silver Sands Church of God. We're encouraging persons to come and worship with us, or stakeholders will be present.
Yes.
So we're encouraging.
Nicola, are you going?
I'm going, yes.
She just confirmed to you.
Yes, we're inviting the public to come and worship with us. And then we have what we call an open day, which will be January the 15th. We're inviting schools, the public to come and visit the NCSA. Hear what we do, see what we do, engage with the staff, get to meet our staff, get to meet some of our stakeholders as well. And it's important for the community to be immersed in the community as the NCSA.
In other words, do not be afraid of the NCSA.
Do not be afraid. Do not see us as the drug police.
Correct. You are there actually like a parent that says, you know, I just went right back to the Bible for a second. You know, when that prodigal son came back, the father did not judge him. The father did not in any way create that distance between them at all and say, oh, you went off and do what you want to do, no, you come back to me. There was none of that judgment done at all. And so that's the NCSA that says, I welcome you back. I will even throw the fatted calf to you. You know, I will do what I have to do to redeem you. And that is the approach that I would hope that people see and hear when you engage with them in your public engagements as well. But it's more than public engagement that will be necessary. So when that person finds themselves struggling, and as the individual who feels distance from the family, Nicolette, who feels as if nobody seems to be hearing me, I need help. Can they walk into you and say, I need help?
No, there is a procedure that they need to follow, and that procedure, basically, we have a hotline. And after, if you want to contact that hotline, you can, and then our hotline facilitator will direct you to the psychiatric hospital. And I want to say that we hold your hand through that process. We have the stakeholders at the psychiatric hospital where we have consultant psychiatrists where we have a close, healthy relationship with, that they understand the kind of person that reaches out to us on the hotline, that they will help us and work with us, and then they will take on the mantle when that person attends to the assessment, and then we follow through with that from our admission coordinator. And that person that is interested in getting help, then that we take that mantle and we walk that person over to Verdun or Marina House. And then we start with them building a therapeutic relationship with them.
I listened to you and I felt what you said.
Thank you.
And got me off completely. Because you said holding their hands.
Yeah.
But the tone with which you said it says to me there's a level of caring. And so there's no need to fear. There's no, so you were able to talk to us about the process without making it seem as though it was such a difficult thing to do. Reach out by calling the hotline. Starts there.
Yes.
Then someone holds your hand and guides you through the process to not just redemption, but recovery.
Yeah.
And that's so important.
Yeah.
But the same thing happens with the NCSA as well.
Exactly. You can call us. Our number is 535-6272, or we're on social media at the NCSA Barbados. It's important for us. We have a counseling department. We're free of charge. Where persons obviously can call at any time. We are here to help. We have an intake process as well, and we also hold your hand throughout the process. We understand the sickness of the disease of addiction, and it's important for the wider Barbados to understand is the disease and not say, well, look, is a moral judgment for persons. Oh, he's a drug user, he's a paro, or she's a paro, and it's important for us to hold those persons who are actually experiencing drug addiction.
But it's hard for a mother, particularly the mother, to watch their child struggle in this way and feel hopeless. And sometimes they resort to get out of here.
Yeah.
Close that door. Don't let him or her walk back in here because I can't handle the drama that comes with it.
Yeah.
And your appeal to parents and to family today is?
It's to embrace, speak to professionals, speak to the NCSA, speak to persons at Verdant House. It's important to speak to them. They too need support. They need probably more support than the person who is experiencing drug addiction. It's important to understand the disease of drug addiction. Many persons don't understand that disease. So it's important then to speak to professionals, get help, call the NCSA, you can call Verdant House. It's important to get as much information as possible. Understand it's not a one-stop shop where a person can just be, boom, they have recovered. No, it's a lifelong disease, and persons can recover, as Nicolette said, for 15 years. One incident happened and caused them to relapse, and they must understand that. It's important.
I want to add that even in our first time collaborating with the NCSA, we have a couple of events as well within this month. And when Troy said that there are persons that have recovered that can help persons that want to get help, we actually have our our jazz, not Christmas, I'm still in the Christmas mood. I'm so sorry. Our jazz event at the Frank Collymore Hall on January 25th, where we have one or two of our recovering addicts that have gone through the treatment facility that will and who are honestly telling their story of recovery. We also have our recovery hike on January 18th. Amazing experience.
That's a very good day, by the way.
Yeah. Oh, I wonder why. And our open day, just like NCSA, but at Verdant and Marina House on the 16th and the 23rd, where the secondary and primary schools are invited to see live and direct what the residential program looks like and to know the do's and don'ts. So
I wonder if we could travel along on one of those tours.
Sure,
and see it
you
for
guys are
ourselves.
invited, yes.
Because it's again, demystifying. It is nothing scary. It's a solution. And I was saying this to the Queen Elizabeth Hospital yesterday because having had my experience at the hospital, now I don't have that fear of the hospital as before. And I'm not saying that you have to go through an addiction to not have the fear, but knowledge empowers you.
Yeah.
And take it from there. Take it from there.
Totally correct. They say knowledge is power. If you can actually see, my first visit to Verdant House was for me, eye-opening. It's the serenity of the place.
And that is the prayer that we live on. We live for every day. It's our anthem. So yeah.
It's a beautiful place. It's important that the public come and engage, especially with the staff or persons who have recovered, and see that there are champions out there. Is live through other persons' experiences.
There are champions out there.
Champions.
See, I hold on to certain catchphrases. You guys are really good at this. Quickly, Troy, your number to NCSA?
535-6272. You can visit us or our social media handles at NCSA Barbados.
535-6272.
72.
And
our
Nicolette?
hotline is 243-0038.
243-0038.
Yes.
The number, the hotline. You'll have me all enthused now. I'm so excited really for what's happening this month, and I really want to commend both of you. Troy Wickham, the Deputy Manager at the NCSA, and Nicolette Williams, who is working with Verdant House. I want to encourage you, if you know someone who needs the assistance, reach out.
Yeah, we're here to help.
Yes, correct.
We're here to help.
They use the phrase, they'll hold your hand, and they literally will. So please do reach out. Thank you both.
Thank
All
you.
the best.
Thank
You're
you.
welcome.
Thank you.
You're welcome. You too.
Morning, morning, morning.